So without much ado, Your Excellency, I want to say, as Kaushik has already said, it is because of you attending a function that we are all here today. And we are here because you then delegated your Chief of Staff and Kaushik, and we had a meeting, I think sometimes in June this year, with Connie and Kaushik. And with that meeting, I was able to inform them if there are resources, we should put them out here in Kajuki. And I think it was from that little talk that today we're here to celebrate, making a difference in the life of 5,000 Kenyans and many more that will be born in this village and in this community, because the capacity this water can give will be up to 20,000 plus people. I just want to say, Your Excellency, like was said earlier, that as vast as our country is, Kenya Red Cross, being a national institution enacted by an act of parliament, auxiliary to the government at the central level, auxiliary to the government at the county level, the head of state is the patron of the Kenya Red Cross, and the governors of the counties, 47, are the patrons of the Red Cross in their counties. It was very easy for us to, we are present in all the 47 counties, and we have local branches in all the 47 counties. Last December here, 2017, we had a cholera outbreak where close to 350 people were affected that needed treatment, that needed assistance. The new county government had just taken over, and the health facilities and health system wasn't fully functional as should have been. So there was a request put on Kenya Red Cross, and Kenya Red Cross was able to respond to come and assist with that caseload. We reached over 2,500 people with health education and indication as to how they should be able to take care of themselves should there be a cholera. But what we say to ourselves is, why should we come and firefight? If we know what the root causes are and what the solutions are, we should go back and look at those solutions and work with the county government. His Excellency Muthomi Njuki, the governor, came to visit in January in our head office and said, look, I have a challenge. I've come to thank you for what you have done on the cholera, but how can we prevent this from happening? I think on that basis, we came up clearly with 3 things to work on, which also very well fitted with the Big 4 agenda of His Excellency the President, which is water, which is health, and which is food security. So earlier in the year, in the March, April, May rains, we gave seeds of green grams, and we know by July, when the farmers were harvesting, there was a bumper crop in this place. We also said we're going to look into the issue of health. And in health, we talked about primary health care to go back to basics. And we said, while we can think of level 4, level 5, and up to level 6 health facilities and health care, if the foundation and the basic is not there, and the issue of universal health care, we said we wanted to go back to basic, to the drawing board, and say, never again have cholera. So go out there and recruit community health workers, volunteers from the same community in these villages, from their homes. And the governor agreed that once we recruited and trained and equipped these volunteers, community health workers, the governor and the government of Tharaka Nithi would then give them stipends on a monthly basis so they can go out and do this work. So the entire health tier system from level 1 to level 5 is then fully functional. We're very happy that actually we got money through our good government of the Republic of Kenya. Through the floods, we apportioned some money for 2 counties on a pilot basis, Tharaka Nithi being one, Bomet being the second one. And today, the trainings are almost completed. 74,200 households have been registered, and we are working with them and with the community health workers. And I'm sure the Minister of Health here, CEC Health, would be very happy that the systems that are being put in place would be functional, and there'll be nothing that will take chance. The second item we worked on was on healthcare, about immunization. We realized that a number of newly born babies were missing on immunization simply because they were not going to the facilities, or if they were challenged with the facilities. So we got a donor who worked on that one, and up to today, I think we have immunized over 98% of children between 0 and 2 years. In all the households in this county, we want to reach 100%. And then from there, it just becomes easier to work with the newly born ones so that there's no one who misses on that. The third on healthcare that we worked with the county is on epidemic preparedness. If there were any epidemics in this county, the county staff have been trained and they'll be able to deal with that. Finally, it is water. And I think that's why we're here today. So with water being life and no water also and sanitations are important. When we talked to the governor in January, he said, come to my county and map up my county. So we're able to get a private water engineer consultant who actually has mapped the entire county. We know where there is water, where there is no water, where is clean water, where there's no clean water, where the rivers are flowing. So based on that and the resources we had the funding that we got through from Qatar. We had some funding from the national government on terms of the floods mitigation. And based on that, the governor and the county chose 2 pilot projects where we could put water. This one of Kajuki today, and we have another one in Kanua, which is only 10 minutes away from here. That also has been done, it's up and running already, but that is funding through central government. So I hope and pray through the CS Water, we will get His Excellency to come and commission that. We said we will not mix the two. This one was yours, and we wanted you to do this one. The other one will ask for the boss himself to come and do that one on a given day when he will have time in his calendar. But we are very happy that within your very busy calendar, you're able to find time very quickly to come and do this one. I guess for me, Your Excellency, the beauty about the people here is that we have a governor that I've worked very easily with. A phone call away, we're able to engage with the governor and his people, and he realizes that even 5 years politically is not a very long time, it's a very short time. So the earlier he gets off the mark and start running, the better. And I'm very happy that today we're here actually realizing something that is basic and fundamental. You know, we take things for granted, but the fact of the matter is, and many of our citizens today, unfortunately, are still drinking raw water. And we cannot allow this to continue happening where we can get resources. When donors like Kaushik and others come on board, we also must realize that private-public partnership is a must, because central government or county government can't do everything on their own. And I think, like the CS was earlier saying, sometimes bureaucracy with government, with county and central is much bigger, and it's much more easier and more effective and efficient with civil society and NGOs, but also that are credible. Not all of them or probably have that. So for us, it was very easy to get contractors to come and do this work. We got technical people, and we're using local Kenyan companies who did this one. We have Iriko and Davis and Shatleaf, who we contracted, who did both projects. And we have done many others for the floods, which I will talk to the minister for His Excellency to come and commission. But just to say, for us, very delighted, thanks to you and your good office, and by the fact that you went to one function, today we can see the difference and the impact it's going to have to many Kenyans.